Welcome to the Reflection Nook for Module 2. As you'll see below, there is a link to a blog titled What I Contribute to Patient Care. When you click on this link, you can submit an entry into your blog, and I want you to reflect on 4 things about your own contribution to the healthcare team. First, I would like for you to tell me your specific role. Then I would like for you to tell me specific tasks that you would do to take care of Meredith in this case study. Be very specific and make sure you justify what you're doing based on her condition. Also, I would like for you to tell me any particular settings that you might be able to work in. For example, a nursing professional can work in a variety of settings, including med-surg units, intensive care. They can also work in the OR, the ED, and even home health. So identify any place that you potentially could work. And then lastly, I would like for you to list any other professionals that you think you might communicate with so that you can actually do your job better. So think about who you might talk to whenever you're performing your role. I'll give you an example of myself. So I would identify myself as a medical lab scientist. Specific things I would do for Meredith is probably run a complete blood count, look at her red blood cell levels, her white blood cell levels, and her platelet levels. Often patients who are going through chemotherapy have very low levels of all cellular components, and so I could look to see if that treatment had affected her in that way, making her anemic, making her susceptible to bleeding, and probably making her susceptible to infections. I also might do urinalysis or chemistry panels to see if her kidneys are functioning okay from chemotherapy. And if they think that she has an infection in the ED, I may also do some cultures or some testing to see if she does have any kind of sepsis. The settings where I work are very limited. I would most likely be in the clinical lab in a hospital setting. Maybe in a reference laboratory, but for the type of testing that she would need, you find most of that in your hospital clinical labs. And then communication, I know that if any tests came back on Meredith that were critical, I would need to call the nurse taking care of her to report that so that I could document I had told her healthcare provider. If it was after hours, I may need to contact her physician. And on a rare occasion that I found something very abnormal, I might need to contact her oncologist. But besides that, I probably would be working with very low communication. So that's my own reflection for my role, and I would like to see what you reflect on for your role. I look forward to reading these, and if you need any help, please feel free to reach out.